the people who died, 3,000 and odd people who died from COVID, were already sick. They had compromised immune systems, and they were the ones who ended up in the ICU and who needed the oxygen and so on, and who ultimately passed, for the most part.
In an already burdened healthcare system, how does the government intend to fund long COVID?
Okay. Well, again, in keeping with universal access, which we now offer, even though in some instances one could challenge the quality of the access, the impact of long COVID, as I understand it, is going to manifest itself in, some of the very challenges that we face now, for example, with NCDs. I tell people every day that as good as we have done so far, and I want to really give my tribute to the healthcare workers, the people who died, 3,000 and odd people who died from COVID, were already sick. They had compromised immune systems, and they were the ones who ended up in the ICU and who needed the oxygen and so on, and who ultimately passed, for the most part. The long-term effects of those who would have been vulnerable anyway are likely to persist, and what we're going to have to do is make provisions to incorporate those circumstances within the existing system. Now, will that mean an added strain on the system? I suspect it will, and this is why some of the things that we're doing, by assessing the side effects of COVID and applying a budget to that. So, for example, we have launched 2 specific programs, one dealing with surgery backlogs, one dealing with mental health. And those are because we feel that COVID will linger in those areas for the next year or 2. The long COVID will be another. And so there is an approach to primary health care expansion that was tabled, by the way, in the Parliament when I spoke, which would mean more doctors at the community level, more nurses to the extent that we can find them, and more services. And part of that would be to enhance the response. But again, it makes this issue a lot more germane because it now brings into sharp focus affordability. This is from the government perspective. How do you afford it? And so it hastens the need for us to find a conclusion around some of these issues.